Some orthopedic facts you should know. Yes. First is miserable malalignment syndrome. Increased femoral anteversion plus genu valgum plus external tibial torsion. That is miserable malalignment syndrome. Talus is the only bone which has no muscular attachment. Really? Now spinal canal is widest at C2 level. Okay. Vertebra with most constant number are cervical and with most variable number are coccygeal. Right? Now facts you should know that patella is the largest sesamoid bone within quadriceps tendon. It has thickest articular cartilage 8 mm and still most frequent site of the articular cartilage degeneration. The most pain sensitive structure in joint is capsule and least pain sensitive structure is articular cartilage. Intervertebral disc is the largest avascular structure in the body and constitutes 33% of the vertebral height. No disc exists between C1 and C2. Okay, man. Then most common PNI is radial nerve. Least common nerve to be involved in entrapment neuropathy is femoral nerve. Most common nerve injury in post-injection palsy, that is IM injection, that is sciatic nerve more than radial nerve. Post-injection palsies are neurotemesis. Earliest indicator of the nerve recovery is EMG. Most common site for taking nerve grafting is sural nerve. Most common site for taking muscle grafting is palmaris longus. Now, Ponseti is first discovered method of management of CTEV, that is manipulation and casting. Tubercular rheumatism is Ponson's disease. Most common complication of triple arthritis is talonavicular pseudoarthrosis. Most common cause of painful limb in a child less than 10 years of age is transient synovitis of hip, more than septic arthritis, more than Patch's disease. So most is transient synovitis of hip. Most pathognomic feature of rheumatoid arthritis is rheumatoid nodules. Most common site for the rheumatoid nodule is olecranon. Okay. Now, first radiological sign of rheumatoid arthritis is soft tissue swelling more than juxtaarticular osteopenia. Most common arthritis to involve wrist is rheumatoid arthritis. The first joint to be involved in the ankylosing spondylitis is sacroiliac joint more than lumbar spine. First excess sign of the ankylosing spondylitis is haziness and widening around SSI joint due to subchondral erosion more than sclerosis more than ossification. Most common extraarticular manifestation of the ankylosing spondylitis is acute anterior uveitis. Most common joint involved in the osteoarthritis is knee more than hip. Most common bone involved in the osteoarthritis of knees is patella. Most common muscles involved in osteoarthritis of knees are quadriceps. Earliest extra feature of the osteoarthritis knee is reduction in the joint space. First line drug is paracetamol. In hemophiliac arthropathy, knee more than elbow more than shoulder. Hemophiliac pseudotumor is soft quadriceps, hard femur. Most common nerve entrapment in hemophilia is femoral nerve. Most common cause of loose bodies in knee joint is overall osteoarthritis. Young adult is osteochondritis or dehiscence. Elderly osteoarthritis, but most common cause of multiple loose bodies in the joint is synovial chondromatosis. Most common cause of avascular necrosis of the femoral head is idiopathic more than steroids. MRI is the investigation of the choice for avascular necrosis. Most common cause of the monoarthritis in children is tuberculosis. Most common cause of the bony ankylosis is septic arthritis. Most common muscle involved in the poliomyelitis is quadriceps femoris or partial paralysis. Most common muscles to show total paralysis in the poliomyelitis is tibialis anterior. Most common muscle of upper limb involving in poliomyelitis is deltoid, and most common muscle of the hand involved in the poliomyelitis, that is opponent's polysis. Most common congenital foot anomaly is CTEV. Prime deformity in the CTEV is talonavicular subluxation. Most common type primary idiopathic type. Most common deformity to recur in CTEV is equinus than the varus. Most common cause of the failure of conservative treatment of the CTEV is non-compliance with bracing. Most common cause of genu varum is rickets more than idiopathic, and child and osteoarthritis elderly. Most common cause of genu valgum is idiopathic more than rickets, child and rheumatoid arthritis adult. Most common cause of the wind-shaped deformity is rickets, child and rheumatoid arthritis adult, but the term was originally given by rickets. Most common metabolic bone disease is osteoporosis. Earliest symptoms of the osteoporosis is back pain. Most common complication of the osteoporosis is pathological fracture. Less than 70 years is Colles fracture, and more than 70 years is dislocation spine. Overall dislocation spine, that is vertebral fracture. Investigation of choice or gold standard investigation for osteoporosis is DEXA scan. Drug of choice for osteoporosis is bisphosphonate. Drug of choice for bisphosphonate resistant osteoporosis is teriparatide. Most common symptoms of the osteomalacia is dilating pain of the lower backs and hips. Gold standard investigation for diagnosis of osteomalacia is bone biopsy. Most common cause of the orthopelvis, that is protrusion vestibuli in India, is osteomalacia, and world is rheumatoid arthritis. Most common site for the skeletal TB is spine, more than hip, more than knee. Least common site for the skeletal TB is bursal tuberculosis. Amongst bursal tuberculosis, most common bursa to be involved is trochanteric bursa. Most common site for spinal TB is dorsal more than lumbar, more than dorsal lumbar. Most common type of the anatomical lesion in the spinal TB is paradiscal TB. Least common type of the anatomical lesion in the spinal TB is posterior type. Earliest and most common symptom of spinal TB is back pain, and earliest and most common sign of the spinal TB is paraspinal muscle spasm. Most common cause of paraplegia in spinal TB is compression by tuberculous granulation tissue or pus. Most common site of the paraplegia in the spinal TB is upper dorsal spine. Order of neurological involvement in the POTS paraplegia is first ankle conus, then plantar extensor, then motor deficit, then sensory deficit, and lastly bladder and bowel deficit. First access sign of the TB spine is disc space reduction. Investigation of choice for spinal TB is MRI. Best of the gold standard investigation for POTS spine is CT guided biopsy. And earliest access sign of the healing POTS spine is sharpening of the fusy paradiscal margins. Now, first radiological sign of union, that is callus, provision of the soft callus. First clinical stage of union is oven bone or hard callus. Bone acquisition or formation is best in adult normal bone, that is Hausif's lacuna, by osteoclast in cutting cone mechanism, and fractured bone is subperiosteal cambium layer. Up to 10 cm bone lengthening has been achieved by Elizarus fixatus assembly. Metastatic carcinomas are the most common cause of destructive bone lesions in adult. Lung more than liver more than bone, most common sites of the metastasis. USL, University of Edinburgh solution, chlorinated lime 12.5 gram plus boric acid 12.5 gram mixed in 1 liter of the distilled water. And 5th, 6th, 7th ribs are most commonly fractured during CPR. Lower limb fractures with shortening, post-hip dislocation, more than fracture SOF, more than subtrochanteric fracture, femur fracture, IT fracture, intercapsular neck fracture. Now, PCL is 1.5 times thicker than ACL. ACL injury is more common in female athletes than male athletes due to smaller notch, hormonal influences, and ligamentous laxity. ACL tears are most common in mixed substances, while PCL tears are most common found in the femoral attachment. Multi-ligament knee injuries are defined as disruption of at least 2 or the 4, that is ACL of the 4, ACL, PCL, MCL, and LCL. ACL tear is the most common cause of hemarthrosis in the knee joint. Atypical or complex ATAV, very rigid clubfoot which is short and stubby. Underdeveloped calf muscles and are characterized by severe cavus and marked equinus. Acute or chronic developed, that is Staphylococcus aureus. Sickle cell anemia is the Salmonella. IV drug abuse or Pseudomonas. HIV or immunocompromised Staphylococcus aureus. Animal is the Animalvitis pasteurella. This is the most common cause of. Now, most common in the trauma, dislocation is shoulder more than elbow, recurrent shoulder more than patella, habitual shoulder, children elbow. Most common mode of spinal injury, fall from height. Most common site of the cervical spine injury is atlantoaxial joint. Most common site of spinal cord injury is cervical spine. Most common site of spinal fracture is D12 more than L1. Most common type of compression fracture is D12 more than L1. Most common site of the fracture after fall from height is D12. And most common spinal injury mechanism is flexion. Most dangerous spinal injury mechanism is translational injury more than flexion rotation, more than flexion distraction. Signs of fracture: serous sign is loss of transmitted movements. Pathognomic sign is bony crepitus. Consistent sign is tenderness. Now, stress of the occult fracture, that investigation of choice is MRI. Bilateral stress fracture is bone scan. Screening of neonatal hip is USG. Developmental dysplasia DDH is MRI. Developmental dysplasia of hip. For early confirmation of the osteomyelitis is MRI. Osteoblastic blastic or sclerotic metastasis is bone scan. Osteolytic metastasis is FDG PET. Knee ligament injury is MRI. Gold standard is the arthroscopy. Site of non-union, that is distal 1/3 tibia. Cause inadequate immobilization. Site for bone grafting is iliac crest, although best source of the cancellous bone graft is posterior superior iliac spine. Site of stress fracture tibia. Second most common site of the stress fracture is shaft of second metatarsal, also called as Marsh fracture. Site for metastasis is thoracic spine. Site of pathological fracture is femoral neck. Cause of recurrent shoulder dislocation is Banker's lesions. Most common site of the osteomyelitis in adult is acute and chronic vertebral body.